To safely use the Sara Steady. The first thing Marlene's going to do is just run through some pre-use equipment checks. So the wheels are moving freely. We're then going to apply the brakes to make sure that the brakes are working, and then we are going to test whether the legs open and close. We're then going to look at the paddles to make sure that the paddles move freely and that the equipment is clean and clear and ready to use. So we're bringing the equipment in, legs open, just around Karen's chair. We'll ask Karen to place her feet on the foot plates, and we'll bring the equipment in so that Karen's legs are resting on the purple pad. Marlene's applying the brakes. We're going to ask Karen to lean forward to hold on to the Sara Steady bar. At this point, Marlene can come round and offer guidance to get Karen into the equipment. Now this is just going to be a hand on the small of the back, or applying the sit to stand where you're on the hip, and then on 3 Karen is going to generate all the movement, so she's going to pull up and weight bear. Marlene's only offering a small amount of guidance, so 1, 2, 3 and up. Once up, we're going to put the paddles down and encourage Karen to sit on the chair. We're going to make sure that while we're carrying out this manoeuvre that Karen keeps her bottom on the paddles and her knees against the purple plate. Brakes off, and we're moving to another location. This piece of equipment should only be used for short distances. It can go over a threshold, it can go from room to room. Marlene is then going to push from one side, so the brake is on one side, and pushing the opposite handle gives you a tight turning circle. This works well if you're in a restricted area and you're trying to manoeuvre the equipment. Now we'll take Karen back to the seat. Once we're back to the seat, we're going to put the brakes on. Encourage Karen to stand, and then Karen can feel for the arms of the chair and sit. Perfect. Then we'll move the equipment out of the way, and Karen will lift her feet.